Making all the arrangements for early start. I'm going to call the meeting to order, and we'll move to item number 3, an update from the AG's office. Chris, turned over to you.
Thank you, Mr. Chair. And we do have a number of updates to discuss. First and foremost, I did want to let you know as of this week, the Kroger settlement was ordered by the court, so we will anticipate receiving funding from that settlement probably starting next month would be my expectation, which is exciting. For the next monthly meeting, I will have the exact dollar amounts per year that we can discuss, and I'll incorporate that in our projections going forward. Next, on the Purdue bankruptcy, I think we discussed this last month, but I did want to let you know, in case we didn't cover this, that there was announced publicly a resolution to the Purdue bankruptcy, and the Sackler family was going to contribute to that resolution. There are still details being worked out, so I do not have a timeline as to when we would expect that resolution to be complete in Kansas, nor do I have a dollar amount to report, but I did want to let you know that there was positive progress there. Less positive progress is the Walgreens settlement. I'm certain if you've been paying attention to the news associated with pharmacies, as I do, you will have seen that Walgreens has been experiencing some pretty significant financial difficulties over the last couple of years. In response to those difficulties, Walgreens has sold itself to a private equity firm, which will likely give it some short-term stability, but if past is prologue, the long-term future of Walgreens is perhaps not clear, or not confident is maybe the way I would put that. So what that means for our settlement is that while we have received, I believe, the first 2 or 3 years of the Walgreens payment, I haven't looked exactly how many years we've received, it was expected to go over a number of years, and so we'll have to determine whether or not that will result in a reduction of the amount of money, if there will be any disruption whatsoever. We are working at the state level and the national level to do our level best to protect the revenues from that settlement. But I did just want to flag that potential instability going forward. Couple other points. I believe that we are getting close to publishing our municipal report. We should have just about every report from municipalities in, with I think a couple that we are working to answer some questions, get some additional details, but we are making progress on the municipal report for calendar year 2024. We do have the municipalities conference next month. We have sent out invitations to all of the participating municipalities. I think we've had a pretty solid response rate so far. I think we anticipate getting some additional responses going across this month. But we are looking forward to that. That's going to be April 18th in Overland Park. If you are a municipality listening to this, hello. But please do reach out so that we can get you a copy of that invitation. And then finally, this is just a conversation starter. Given some changes in federal fiscal policy, we may be facing a substantially different treatment and recovery landscape in the over this year and in years going forward. So the board should just be cognizant of that while making strategic decisions that we may be one of the larger funding sources still available in the state. So I just wanted to make certain folks are aware that there are federal conversations that are happening that may impact how significant or how important this particular funding source is in ways that we had not anticipated earlier in this process. I think that's all I've got, so if you have questions, please let me know.
Here is the event on April 18th. Is that at the convention center there in Overland Park?
Yes.
Yeah,
And there will be a remote option as well for folks who are not able to attend in person.
okay. So just with the board, if you want to send out some more information, then we can just remind any local officials, city, county, that you might come across in your day-to-day travels. We'll be glad to spread the news. I know you guys have worked very hard on getting a presentation together, and should be good.
And yes, Nancy will send out that to the invitation to the board along with the flyer.
The league is always happy to send out a notice to or a reminder if you want. I know that you can, certainly contact them, or I can contact them too.
We the reason we were using our mailing list is because it's would not send an invitation to people who were not eligible to receive funding, but I do appreciate that. And if we need to drive up our participation number, we will probably reach out to you.
If you need a cat.
I'm fascinated with the cat. Love it.
Well, thank you. Any questions for Chris?
Yeah, Pat, this is Sandra. Sarah, you and I have the same cat, just so you know. Chris and or Krista, I appreciate, Chris, you bringing up the conversation about what potential changes might happen over the next couple of years, and there's a lot to keep up with. Is Sunflower or the AG's office kind of keeping up with those federal changes and potential, I'm using my words really carefully here, the potential changes to funding to keep us informed of that? Because I do think it's something we should be kind of looking at every meeting just to see what's the latest and how does this impact how we allocate dollars.
So I will say that for the AG's office, I don't believe we're tracking it at an office level. I have been following just as a member of the public the news, and the one that I saw this week that prompted me to tell you or raise this issue was that I believe SAMHSA is potentially going to be subject to staffing and funding cuts.
Thanks for bringing that to our attention, and we'll see how it rolls out. It certainly might change our direction. Of course, it won't change our mission. So please, any information you get, forward that to us. Any other questions or comments for Chris? Okay, we will move back to item 2. I see Gary joined us. So we got a form now. And Connie, you have everybody recorded, or should I do a roll call for you? I forgot.
Roll call would be great.
Okay. Sandra?
Here.
Gary?
I'm here.
Robin is joining later. Ken?
Here.
Monica? Sarah?
Present.
Mike Brower?
Here.
Mike Kege? Keith Rickard? Jason Hess? All right. Thank you. Item 2 is the approval of the board minutes, and those were sent out earlier. I would entertain a motion for passage in a second.
This is Sandra. I move to approve.
This is Mike. I'll second.
Mike seconds. Any further discussion? Seeing none, all in favor? Aye.
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 Opposed, same sign. Thank you. Now Shanna will give us an update from Sunflower, financial update. So Shanna.
Good morning. Thank you, Chair. I think you'll find a couple documents in your packet. The first one is a total fund balance summary. Just a couple of reminders and notes for this. This top portion includes all of the financial items that have transpired since January of 2023, so just over 2 years. We've received total account deposits of just north of 85 million. So far, we have earned interest in the tune of 3.8 million. The total grants paid to Sunflower, including the $1.5 million needs assessment, is just north of 2 million. So you can see there the interest is covering the amounts that have gone to Sunflower for administrative support and the needs assessment. Total RFP grant payments that have been issued for RFP 1, 2, and 3 is just north of 11 million, leaving the bank balance as of February 28th at $75,210,328.79. I do give you the earmarked numbers for each of the RFPs that are amounts outstanding. So you can see here 1 and 2 have a few lingering dollars that we're just kind of waiting to finalize the reports and button those up. RFP 3, you'll see we have 6.5 million outstanding, but we did issue $2 million in payments in February. So that first round of payments went out to RFP 3 recipients at the end of February. RFP 4, those first round of payments will go out at the end of this month. So an unallocated fund balance remains of $62,203,084.19. A couple of things to note on the account. The interest rate, while still healthy, has dropped from 5 to 3.6%. A reminder, we do have 100% FDIC coverage on those dollars with access to funds on the daily. So we have daily liquidity on that account. I would pose for or stand for any questions.
Any questions? Very good report, and thanks for sending out the detail to keep us up to date.
Sure thing. Okay, we will move on to our invoice for services for the fourth quarter of 2024. If you recall, this was also during the time in which we had the RFP 4 reviewers meeting. So again, our invoice, if you're tracking, is slightly higher given the activity that took place during this quarter. Just a reminder for direct grant administrative project support, which includes salaries, benefits, any kind of staff training or conference that Krista or Alyssa would endure, the Flux grant management system. Again, the RFP reviewers meeting plus the actual reviewers payment went out the door during this period. That total a direct grant amount or total grant support amount rather is $108,561.59. We were approved for the indirect rate as a reminder not to exceed 10%, which is just that of what's allowed for our grantees as well, $10,856.16. Therefore, Sunflower is requesting a grant to cover our administrative support for $119,417.75. And I would also stand for any questions.
Any questions for Shanna? Seeing none, would entertain a motion for approval of the invoice for $119,000 and change.
Mr. Chair, not to make this more complicated, but I think you need to structure that as a approval of a grant rather than an invoice.
Okay. Look for a motion to approve the grant.
This is Mike. I move to approve the grant for $119,000 and change.
Sarah Kaler will second.
Thank you.
A motion and a second. Do I hear any other questions or discussion? All in favor? Aye.
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 Opposed? Same sign. All right, unanimous approval. Thank you very much. Thanks for the information, Shanna, and we will move along here to item 5, grants updates and the needs assessment update. Alyssa or Krista, who's going to go first?
I'll start. Mine's pretty quick. Right, it's echoing.
Did I do that?
You did. All right, so grant updates, I'll be pretty quick. Shanna shared what's outstanding in the payments that we have for all of the RFPs. We have 9 still outstanding from the new round of grants that are still pending their signatures or paperwork, finalizing some few details and just getting those wrapped up. But then the remaining 67 that were awarded of the 76 have been initiated. So unless anyone has any questions on grants, I will pass it to Alyssa.
Questions for Krista? Thank you. Alyssa?
Good morning. So I have a few updates, and so we are looking at the needs assessment deliverables are due at the end of this month, March 31st. And so we are looking forward to sharing those with you guys once we have them. Krista and I continue to work closely with CPPR to refine the report, keeping an eye to ensure that we're including the full scope and having a more critical eye on the organization of the document itself, really trying to ensure that it's easy to read, that the flow of content is working really well, and then also an eye to try and really not use like jargon terms and ensure that it feels very readable and accessible, not only to the board, but to the general public. Other than that, we have the accountability cohort. So that is our group of lived experience experts who have been working with us. They have their final meeting next week. And we're going to be going over the overall report and then review and kind of get their input on the priorities, different strategies, different tactics that have come forth. And so we will be hosting that. We're really excited for them to see the draft final product and provide any remaining insights they have on it. Other than that, I am continuing to work with CPPR. We are doing a presentation at the MFAF conference in April that is going to focus on findings of the needs assessment, but geared towards specifically how municipalities will be able to utilize the information within it. And so that will be something that I do with CPPR staff. Other than that, I wanted to hopefully get a little bit of more insight moving into the next month's meeting in April when CPPR will be here to present the findings to the board. So just in summary, the report is organized within the 3 Horizons framework, which they have touched on with the board before. So that framework focuses on gathering information and understanding where we are now, where we would like to go in the future. So for this project, we've been talking about at the end of, I think they have 2044, if these dollars are invested, what does that future look like? So we've gathered that information, and then based on best practices, research, and insights from communities, really focused on how do we get from where we are now to where communities think we should be going. So that's going to be the framework of the report. And then we have been working with to really focus in on some graphics, knowing that it's going to be a lot of content. It's going to be a long report. So really utilizing those visuals where we can. Other than that, there's going to be various other sections that focus on the full scope of the needs assessment findings, really focusing on what the needs are within the state and at, I believe, regional areas, and then opportunities identified. And that will flow into chapters that are going to discuss specific details and findings based on key topics. Like, so for example, treatment access, prevention, harm reduction, recovery, workforce. There's going to be many chapters that are just really focused. So trying to provide focusing on the framework and what does that really look like for us to create systematic change, but then understanding that there may be audiences who are looking for really specific information about their area of work or about certain areas. And so we've just been trying to find that balance of organizing the information in those different ways. And so again, it remains ideally a very accessible document. In terms of the actual presentation next month, we are planning, so Krista and I are working with CPPR on that, and we're planning on focusing really on the findings and the associated needs and opportunities that they have that have come forth from the process. We know it's going to be a lot of information across a lot of different areas, and so I'm hoping to maybe get today a little bit of insight and information around what some members are most interested in hearing or learning from this initial presentation. For example, is there any specific data that anyone is interested in hearing about and seeing? Or are there any specific topic areas that have been top of mind or that you really have been thinking about throughout the past year that would be really great for us to highlight next month? Open to any suggestions or any thoughts.
Yeah, thank you. And if feel free to email or call either Alyssa or Krista too, if you think of some information that you would like to see pointed out. And just as a in my mind, we will have a presentation at our April meeting and overall presentation and cover a lot of material in a general way. And then we've talked about perhaps having one or two Zoom meetings out of our normal scheduled times to bring up specific questions. For me, I don't really know what questions to ask until I have kind of a general overview, and so that would be a suggestion, I guess, Alyssa, on the presentation. I don't want to, a couple hours in my old age kind of is about as much information as I can handle. So if we get a couple hours at our April meeting, then we can schedule as need be. So I'll shut up from there and invite the board. Any other comments about presentation or specific information?
Chair, this is Sandra. Alyssa, couple thoughts. One is, are we going to get something ahead of time to look at before the meeting, just so we have a sense of what's coming, like an executive summary or something like that? Do you know?
Yes, you definitely will.
Okay. One of the things that I'm interested in hearing about, and we talked with them when they were presenting to us the first time, all the historical documents when needs assessments have been done previously. And I know they have looked at all those and reviewed all those. I'm really interested in what they have learned that's different from those. So what new information from communities, what recommendations from communities might be different than the things that we have heard historically over time in other needs assessments. So looking for what's the innovation, what's the new, what might be different.
Yeah, that sounds good. I know Krista and I are also really eager to bring forth some of those things. So we'll make sure to find a way to highlight those and really focus in on what those innovations or just new insights at the community level looks like.
Thank you. Other questions or comments? Very good. Really looking forward to the presentation on April 11th. And again, to the board, if you think of something that you would like presented specifically or even have any questions, it'd be nice if we got the executive summary, at least a week in advance. And even from that might prompt some questions that could be answered in our regular meeting on the 11th. So thank you very much, Alyssa. Looking forward to that.
We'll make sure to definitely provide an executive summary and then also potentially any highlights that we think may be relevant or interesting to the board. So you guys will have those.
Great. Thank you. Well, we'll move on to item 6. Krista, you might recall that we had a presentation from several entities, not all 3, I believe there was, could make it at our last meeting. And so just wanted to follow up because there's at our next meeting, we might look at, where we're kind of getting out of the box from the RFPs and getting into innovation. If this would be a good collaborative effort that we might want to take a, initial funding position for it, but we will look at that at the next meeting. But I just wanted to get a reminder of what we covered last week or what they did. And then also Krista was reaching out to KDADs to get any input they have. So Krista, turn it over to you.
Yeah, since KDAS wasn't able to attend the meeting last month, I asked just for at least some kind of write-up, and they provided an email. And so we got from the Behavioral Health Services Commission an email that said that they wanted to let us know and the KFA board know to speak to their support of the SAC ComCare Crisis Intervention Center Detox Unit project, letting the board know that this aligns fully with our mission and vision as an agency of integrated care. This model could be leveraged and utilized for other communities in Kansas to show how to lean on partnership to serve the need of the continuum for their constituencies. And he also added, if you have any additional questions, feel free to reach out. So it's a quick email, but just saying that it fully aligns with their vision and mission, and they support the project from the KDAD side of things. And any questions about that specifically? Or any questions you might have for KDADs that I could send to them? Okay, if you think of anything, let me know.
Go ahead.
Okay, thanks, Pat. So again, just a quick rundown. They presented on the co-location of the SUD treatment provider and the CCBHC and the full continuum of care that they're able to provide, missing currently medical detox. And so I can do a full kind of summary again next meeting when we have a further discussion based on what the presentation was. But the original gap that they listed was a little over 700,000. However, upon reading the local needs assessment for the Wichita-Sedgwick County Municipalities Fights Addiction Fund, they have outlined where they've allocated at least percentages of their settlement dollars. And one of those areas is treatment. And one of those priorities lists specifically establish a medical detox program within the new crisis center by 2026. So exactly the same thing we're talking about here. Of course, those dollars are much more limited, so I am not sure that they'd actually be able to cover the full entire project of the 700,000, but we're thinking that it might be helpful for Pat, if he's willing, and Chris and I to meet with the local municipality folks to figure out their plan and allocation and kind of timing, so that we can figure out the actual costs that would be the gap that KFA could help with. So kind of braiding that funding with the municipalities in that way. So we're thinking that we'll try to get that scheduled and can come back to you all with the findings and have a discussion at that point. If there are any other questions, let me know.
Questions for Krista? Well, thank you for the review and the update, and we'll look forward to getting more information. It's certainly listening to them at the last meeting. The number one thing is that it addresses a very critical need and does it in a collaborative way that we've been talking about, hopefully doing from once we get the needs assessment and some innovation, and also with the added piece of collaborating with the local municipalities with their funding from these settlements. I think that's all exciting. So we'll look at further information and consider whether we want to be a partner in the funding of this collaborative effort. It'd give us a chance to kind of do a first one out there. Experiment's not the right word, but at least kind of see how it works there, and at the same time providing a need that we all know is very much there. Any other comments or questions? Well, seeing none, we got done. I won't miss my flight. Again, thanks for starting early today. Thanks for staff for showing up. I know you had a room change, I think, too, so that must have went flawlessly. And we will look forward to our next meeting on April 11th. There at the Capitol, a lot of information will be presented. So if you can make it in person, that'd be great. If you need to join via WebEx, obviously that'll be an option as well. So with that being said, I will adjourn the meeting and have a great weekend.
Bye.